can affect the physical rehabilitation when the craniofacial system it is not in balance. This is a very, very important topic, and we will start the presentation today. All right? How craniofacial system affect the physical rehabilitation. Sometimes we say what it is, because as a physio, maybe you will not understand what happened when our craniofacial system is not in a well function. Craniofacial system, it is not TMJs. A very, very wrong concept is when we said, I am treating TMJs. TMJs, it is temporomandibular joint. It is part of the craniofacial system. And then we will start the presentation. When we're talking regarding the craniofacial system, we have to understand what it is. That is our school. Our school is an international school. It's a very, very international school. We teach all around the world. We teach in America, we teach in North America, Central America, and South America, and we teach also in Europe, and we started to teach in Asia. And this year we push a lot to teach in India. We have a lot of people follow us in India, physiotherapists mainly. Our school is a school where we are teaching to all medical sciences. We teach for physiotherapists, we teach for osteopaths, we teach for medical doctors, for dentists, for every medical sciences. And today you will see one part of our teaching. When we talking regarding craniofacial system, we are talking about an important system, because when this craniofacial system it is not in function, it will create a lot of troubles, as you will see today, in the muscle change. And you, as a physio, you work with muscle change every single day of your life. Imagine if you want to do a rehabilitation and someone or somebody is disturbing you. The rehabilitation will not be perfect and also will not be permanent, and that's very, very, very important. And that is the topic you will see today in your group, how this system is disturbed. Craniocervical and facial, because the name is craniocervical and facial system. That means the jaw, the cranial, and the neck. This system is interacting with the rest of the body every single minute of our life. It's very important to do a good diagnosis and intervene. We doing courses in July, in end of July and August we will start a course to teach that. Today is an information, no? To teach how to treat and how to obtain an effective rehabilitation. And that's very important for all people who they do rehabilitation as you. Temporomandibular joint, as I told you before, is more than a joint. It's part of the craniofacial system, and this is an important part, but it's just a part. The mandibular position is very, very important, because when we lose the central relationship of the jaw, that is creating a reaction in the whole muscle change. And you will see today, synthetically, how it works. Craniofacial system, it is a great disturbing in your therapies and in our therapies when this system is not in a good balance, and that is very, very important to understand. And now we're talking from TMJs to the eyes. Imagine that is a topic, that very important topic. You say, what it is? TMJs to the eyes. One is in one part and the other is another part of the cranium. How we can go to TMJs to the eyes? And you will see. TMJs is this part of this craniofacial system. The eyes. The eyes, or more, better say, the oculomotor system is one of the main receivers of our tonic postural system. Tonic postural system is a cybernetic system that regulates the basic muscle tone of our muscle change. And imagine in a muscle change, if we have someone who is disturbing that, it will be a chaos. How the eyes or the oculomotor system affect the posture? How? In two ways. Reflection, that means the vision, and the oculomotricity, that means the movement. If we don't see well, we will alter our barycenter. If our movement of the eyes is not good, we also alter the barycenter and the overload of our body. Imagine that important thing. And as you will see, the craniofacial system is disturbing this main receiver. How? When the jaw position is not right. And sometimes we don't think about. If our jaw is not centrated, and that's happened because teeth are blocking this wrong position, that's very bad for the joints. It's very bad for the hyoid systems, very bad for the neck, and very bad for the posture. And you will see how the mechanisms is working. Changes of the jaw position. We're talking lateral deviation or forward or retro position. That's forward position. That's a retro position. When the jaw change this particular position, centrated position, is creating pressure inside the TMJs. And TMJs do not resist any pressure. TNJs can resist for a limit a traction, but they do not resist the pressure inside. When that happens, they make a deformation, and there is a special proprioceptive system inside the joints to protect them, and you will see it will start a very bad mechanism, very bad defense. You will see later that the mandibular position directly, when it changes, is affecting one of the main receivers of the postural system, the most important of the receivers. And what are they changing? We can have unilateral changes of the position. We say extrusion of the jaw. We see lateral deviation or intrusion of the jaw. These unilateral changes are affecting the movement of the eyes. It's very difficult in short time explain the neurophysiology. Yeah? But when that change is affecting unilateral the movement, it alters the convergence of the eyes, and have a good convergence is very important, because when we have a good convergence, we have a good peripheral vision. Imagine an athlete, imagine in a normal life, but that movement is not coordinated, it altering the head position to have better peripheral vision. It's very important that. And when we have that, we have overloading of the posture in one side. Bilateral changes of the jaw position, that means forward position or retro position, it affects the convergence of the eyes, bilateral, the both, and that affects the posture mainly or forward or back. Imagine how a jaw position in the craniofacial system can alter the posture. That's the research I did many years ago, measuring the jaw position, the convergence, and the overload of the posture, measuring with an instrument. Anytime that we have a lateral deviation, that means one side position is altering the convergence of one eyes, and is creating overloading in one side. Look at there. 1 kilo, when close the mouse, overloading. We have the other option, lateral deviation in the other side. We have the hypoconvergence, one side, and overloading. When we have forward position or retro position, we have bilateral hypoconvergence, no overloading, but we have changing the position, the very center, forward or back. Look at this. A little lady who has a problem in the jaw, this is the test of hypoconvergence. Look at this, another occlusal problem with the jaw change, hypoconvergence. Look at this, another lateral deviation, oculomotor system altered. Look at this. I can show you 1,000 of patients like this. All of them have the same pattern. Look at this. Jaw, posture, oculomotor system altered. This guy was operated for pain. Nobody checked the dysfunctional situation and start to operating lower after more up, because the pain does not disappear. Look at this. If you see scoliosis, adaptive scoliosis related with jaw position, oculomotor system, and other things also. TMJ's problem, look at that. The jaw who is not centrated, oculomotor system altered, and the posture altered. What happened? If we have in our occlusion, in our teeth biting, we have something that we call pre-contact, who create the change of the position of the jaw for adaptation. That is the beginning of the chaos, because the TMJs have more pressure, and in the TMJs we have very important receivers that when we have overloading inside send the information to the brain, and the brain it have the only defense that is for him, only one, and you will see is a very bad defense. He started the bruxisms. The bruxisms is not caused by stress. It's caused as a mechanism of defense to protect the TMJs. It's a very bad defense, but it's the only one central nervous system have. And bruxism later on is causing stress. Bruxism is a defense for the TMJs. Very bad defense. Starting for a proprioception mechanism. Proprioception send the alarm to nervous central system and then start the bruxisms, who is creating a lot of chaos in our body. Why? Because it's making more pressure inside the joint, it's abrading the teeth, it's creating hyperactivity in craniomuscles, neck muscles, and in the posture, and it's creating a very bad. It's correct, it's wrong, it's a very wrong decision. But the brain have the only one decision. I have this problem, act now. It's not thinking. Is to make this, to survive the TMJs. And as a consequence, it's starting a domino effect into the muscle change. Imagine something simple as a jaw position altered. It's something who start and never stop. Now we're talking regarding the TMJs to the feet, another receptor of our posture. Is a very big adaptation receptor. There is not causative. Mainly, it is an adaptation of the feet, and you will see how. Jaw position, very important for M.P.R. Very important. TMJs and posture, we said. Remember, jaw changing the position. When that's happened, starting a very bad problem in the body. Jaw positions change. Look at this. Look at this. Those are X bridges to, to see how the jaw is. Look at this. Jaw position altera. And if you measure, you will see how the posture change. Look at how is open mouth and close the mouth and how it's changing. How it's changing the measure. How it's changing the measure. Always you will see that. The problem is nobody studied that. Nobody pay attention on it. Look at this. The body center of the body is very, very important. If I can ask you what people have in common, you will see a lot of things. The posture is altered, the posture is no good, etc., etc. But the most common thing they have is they are searching the best body center of the body. The body center of the body have to be closer of the body center of the head, because there we use less energy, and the brain know very well that. That's neurophysiology. The brain know very well that. We found the best body center, and we make adaptation. Making adaptation for that, we're creating posture alteration. Good body center always. Our Pisa Tower don't have a good body center. Yeah, it's no good. And look at that. This is another research I did many, many years ago, together with the research regarding the jaw position and the oculomotor system. I measure a lot of people who they have, we create artificial pre-contacts in each teeth, and we study what happened with the foot overload. You know very well Kapanji. Kapanji is, you are physiotherapist, you know very well Kapanji. Kapanji said the body charge, the body overload is divided in the foot in 3 points. The first metatarsus, the fifth metatarsus, and calcaneus. That's study Kapanji, you know very well that. And if you put together the 3 points, you have a triangle. And if you put the body center, if you put the bisectors of the triangle together, where they connect, this is the body center of the foot. Third metatarsus, fifth calcaneus, and 3 arches. Metatarsal arch, internal arch, and external arch. We're not talking here regarding the physiology of the foot, but just to remember that. Foot body center is there. Anytime we did pre-contacts in each teeth, we observe that was overloading. If we put the pre-contacts in the anterior teeth, we observe overloading in the first metatarsus. Imagine, anytime we have pre-contacts in the middle part of the teeth, we call that occlusal plane, we overload the fifth metatarsus. And every time we have pre-contacts on the posterior teeth, we got overloaded in the calcaneus. Imagine how this situation can affect another of the main receivers of the posture. We have 2 main receivers, oculomotor system and foot support. Both are disturbed for the craniofacial system. That is the schema, you see? First metatarsus, anterior part, fifth metatarsus, occlusal plane, calcaneus, posterior part. Imagine how something happened here in the occlusion can change the jaw position and can create overload in our foot. All these situations we can prevent in early age. That's very important. That's why we teach pediatrics to observe that, because this young lady have a foot support problem, occlusal problem, oculomotor system problem, and postural problem. If we do not treat that in that age, she will arrive like this patient, who is not the same patient, is another one. But look at that, have the same problem. In that area, you can prevent it. In that area, you only have to treat. Prevention in early age. Look at that. Scoliosis, most of the time, 95% of the scoliosis are adaptive scoliosis. That if you understood very well the receptors who are bad, you annulate that and you do rehabilitation, scoliosis disappear. Look at that. Occlusal problem, foot support, postural alteration. The same. The pattern is the same. How this change position of the jaw is affecting the muscle chain? It's creating hyperactivity to the muscle chain. And it's creating a muscle reaction. I call that a domino reaction. It's a muscle reaction. The myofunctional postural rehabilitation was born to avoid all these things. Today we're talking in a small part. In less than 1 hour we cannot talk all together. How the craniofacial system alter the muscle change. It's very important to understand that. Changing the jaw position, starting the bruxisms. With the bruxisms, we're creating hyperactivity. When we're creating hyperactivity, we are creating hyperactivity in the whole body slowly. If we change the position lateral, we are creating generally alter the lateral muscle change. The forward or retro position, they alter the posterior muscle change. The yoides system is the connection between the upper part of the body and the lower part of the body. Yoides system is a complex neuromuscular system. When the jaw is changing the position, you will see later in a video why that happened. This hyperactivity is creating hyperactivity in the muscle change. When we have a lateral deviation, the main symptom in posture is the alteration of the biclavicular plane. If in the case we teach what they are, the tests that you have, it's very impossible to do that in 1 hour. No? Look at that, lateral deviation is creating the problem. Now look at this. Lateral deviation, overloading. When the mouse is open into the right, it's 4 kilos. When close the mouse, is arriving to 9 kilos of overloading. Central relationship lost, defensive is bruxisms, is creating hyperactivity in the muscle chains, and is creating a locking in the craniosacral breathing, creating dental abrasion, TMJ disease, and neuromusculoskeletal diseases. Imagine how you can do a good rehabilitation. You can see a video now, it's a dissection video, how these muscles, when you have a retroposition, you are creating hyperactivity in all these muscles, mainly. Lateral deviations in the lower part of the neck, forward and retroposition in the upper part of the neck, creating hyperactivity. and slowly, slowly, slowly they block the vertebrae. When you have hyperactivity chronically, you have a blocking in the vertebra. And you can unblock the vertebra, but if you don't avoid the cause, who was the craniofacial system, the vertebra still carry on blocking the whole life. Look at that, hyoides system. This little bone is connected with the rest of the body by muscles. Suprahyoides muscles and infrahyoides muscles. Look at the muscles. Infrahyoides to the jaw connected, and on the back to the neck. Anytime we change the jaw position, we are creating dysfunction in the hyoides system. And we are creating chronically muscle change alteration. Obviously, also the tongue. Bruxism increase the pressure in craniofacial sutures, creating a locking on it. Most of the time are creating functional asymmetries, not real asymmetries. When we have the most dangerous position for the jaw is jaw on the back. With the bruxisms, when the jaw is on the back, we are creating hyperactivity in suboccipital muscles, chronically descending, and also hyperactivity in all craniofacial muscles, blocking the sutures, the craniofacial, the craniosutures, and the craniobreathing. Chronically, if the phenomenon persists, we are creating hyperactivity in the neck. If that is chronically, we are arriving to have hyperactivity in trapezius and grand dorsal. When we have hyperactivity there, we are creating hyperactivity in this humeral joint and creating a lot of disease. And nobody imagine that that can be connected with the jaw position. And chronically, we are creating hyperactivity in the whole spine, creating chronically postural alteration, adaptive scoliosis, and a lot of neuromuscular problems. The M.P.R protocol in my functional postural rehabilitation is deprogramming the things who are not working well to have a good balance with the rehabilitation, and then we reprogramming the things that they not reprogram themselves. That helps a lot in rehabilitation. We reprogramming all receptors we need, who need it. That allows us to remove the aggression and to have a good rebalance. After the balance, with all rehabilitative techniques, they working better. And we can obtain a neuromuscular skeletal balance permanent with muscle change in balance. And we reprogram the receivers that they need. A specific area intervention depends on the receivers. It allows to have a definitive balance. Imagine if you have a earthquake, nobody imagine to rebuild the houses during the earthquake. We wait. When they stop the earthquake, we do the rebuilding of the houses. The same is with the aggression. With the deprogramming of the system, we stop the aggression and we can have a good planning for reconstruction. Deprogramming, remove the aggression. It allows to study the equilibrium and reprogramming the equilibrium and rebuild after the earthquake. When we have chronic pain, normally is because we don't treat very well the pain, or because we don't prevent the pain. We treat them with tablets, with some rehabilitation, with some insoles, etc., etc., etc. The most important thing in the chronic pain is the integration of all health sciences during the treatment and the prevention, treating early as you can. We have to make the identification of the problem, that means the priority, and then we deprogram the priority, and then we can have a good rehabilitation. And as you will see, the most aggressive thing to muscle change is craniofacial system. When we have a balance, we reprogram the system. The topic today is talking regarding craniofacial system, and we have a device. I invented that device most than 10 years old, 10 years ago. And I call that body equilibrium device because it's a device for the equilibrium of the body, emulating the craniofacial system, and to allow us to have a good rehabilitation. This device for everybody. We teach that device for medical doctors, for dentists, for physiotherapists, for osteopaths. Everybody can do that. It's a thermoplastic device, and you can adapt yourself. And this device has a special material that at the 37 degrees of the body readapt continually. When we have the craniofacial system disturbing, we have to remove this, deprogramming it, and the body equilibrium device is the tool for deprogramming the system, which is a very big aggressor. Body equilibrium device. That's it, the device. It's a thermoplastic device that you can adapt and override the negative effect into the tonic postural system of the craniofacial system. Removes the interferences of the cranium. It is a thermoplastic device which is adaptable for every patient. It's one measure, and you can adapt each patient, any patient can be also readapted and refunctionalized, and that keeps the system annihilated and allow us to have a good rehabilitation. And is using only for sleep. The bed is a very, very simple device. I will show you a small video, no? How it is. It's for physiotherapists to have a better rehabilitation. You see, it's a mobile device that the patient uses during the night time. Flexible, very flexible. It's not attached to the teeth that protect the craniofacial breathing and the craniofacial sutures. And it's a very simple device to use and wear. Look at the effect. I show you some patients. Patients with postural alteration have the planes alter. At this diagnosis, I cannot tell you the diagnosis now, but imagine this is a problem, upper and lower receivers. When we study the body in all directions, is a body anteposition, oculomotor system alter, hypoconvergence, foot support adaptation in varus, and occlusion, teeth and jaw, jaw and teeth, lateral deviation, blockade, and mouth open, mouth closed. When the patient closes the mouth, is overloading 1 kilo more to the left. postural alteration connected with the craniofacial system, oculomotor system, and foot support. In this case, the priority was the craniofacial system. Then we do the eyes deprogramming, and then postural rehabilitation and neuromuscular reeducation and ocular reeducation. Patient with posture who has headache, neck pain, muscle pain, dizziness, TMJs clicking. This pattern we see most of the time. Oculomotor system altered, lateral deviation with retroposition. Look at that, the occlusion, and then the measure. Imagine that. Let me go back. Let me go back. Imagine. Open mouse, and then close the mouse, changing the position to the other side, and the barycenter is going forward. Stabilometry. All altered. Look at the balance of the barycenter, all disturbed and all forward. And torsion. Torsion of the body. Look at another patient. The face of suffering, jaw retroposition and lateral deviation, and look at before and after how the face changed, annulating one of the bigger disturbers of the posture. And look at that, the postural registration before and after, 0 kilos, all straight after bed. Look at this, the bed in TMJs. The mouse is now open. We do bed therapy and look at the mouse, how it's open, straight and good. Look at this, postural alteration, jaw lateral deviation, postural problem of the body, and look at that, lateral deviation of the jaw, anterior forward position, also a little forward position, bilateral hypoconvergence, and the posture before and after. How the measures are 0 kilos of overloading after the bed. That is to show you that the connection we have with the oculomotor system, the foot support, and craniofacial system, jaw position, it can affect all postural rehabilitation, all of them. Imagine if you don't treat annulating this system, who is a big disturber of the posture. For physiotherapists, this is a good tool because allow you to annulate the negative effect of the body. This is the case we will start in end of July. If you can contact me there, if you like, you have the emails, the English website also, and if you like, we can be together in the future study. Okay. Imagine all the things we can prevent if we have this concept well studies. I hope in this small time I were very I clarified the concept. It's very difficult in 1 hour. In 1 hour is very difficult, but we will be in touch if you are interested to carry on a study with us. You know, you have our pages, you have all the things you need. And in Facebook, it's very difficult to answer the questions. Normally, we do that in our virtual room. In our virtual room, we can talk together and we can discuss together. That, I think, that would be the first transmission for you, and we can do more transmissions if you like. Just contact me, and then we can do more and more transmission. I hope this small transmission was good for you, and you can follow us also in our Facebook channel. You know, our Facebook channels, and also in our YouTube channel. This is the two channels we have. You can contact me, and you can be in touch. If you are friends in our pages, you will see all the news, all the news of the M.P.R. International School. I hope you enjoy the presentation. I hope the presentation was good. I cannot check in the Facebook, but I think Facebook was well, the transmission. I will see later the video in Facebook, and we will be in touch. And if you want to contact me, please don't hesitate to contact me, and we will be in touch. Maybe we'll do some presentation also in your page. If you are interested, we will do more presentation just to show how is the connection between the postural tonic system and the rest of the body. That is very, very important. Okay, I say you goodbye. I hope you enjoy the presentation, and we will be in touch in the future. I have to say now just hello. Say thank you to be here. I hope you enjoy the presentation. You're happy with the presentation, and we will be in touch in the future. Bye bye for everybody, and good group of rehabilitation people. Bye bye. See you in the next transmission. Bye bye.